For years, I had problems with my right leg, and I always thought it was plantar fasciitis or something wrong with my foot. I never attributed it to my knee, and a doctor had told me that, well, your cartilages are really bare, and I just thought, And so finally I okay, I was a little afraid. I was nervous because it's a big operation. And so I called out to Ozark Orthopaedics, and I made an appointment. And they said, but we have a new surgeon, Dr. Creech. And I thought, and you can get in like 2 weeks. And I was like, oh, okay, I'll take him. And he was new, and I thought, well, he's just gotten out of school, and so he'll probably be really good at his job. And first of all, I don't think they would have hired him if he wasn't, but I thought he'll be up on the latest techniques, and I was not disappointed at all. He's a wonderful, wonderful man. It was quite easy. I mean, they did everything for you. They gave you that afternoon, they made the appointment for the surgery. I mean, that morning they made the appointment for the surgery. They set the date. They gave me a big handout on everything I would need to know, my preparation, what to expect afterwards, what to expect during surgery. And I mean, I was very, very nervous, so I was I wasn't a hostile patient, but I was like a little like, I don't know if I want to do this. But they all put up with me, and they just walked me through it, and they put up with my questions and everything. And so, they reassured me that because I didn't have any concept of what was going on, I just knew I didn't want to not be able to walk again. And so that's kind of scary when somebody says, okay, we're going to operate on your knee, and it's really frightening. They all were very, very reassuring, and they told me if I had any questions, just call, we'll answer them. And they did. The day before surgery, this is the part about Dr. Creech that I just fell in love with, is the day before surgery, the night before, he called me at home. And he wanted to know, do you have any questions? And I was like, well, no. And he said, are you okay with this? And I was like, sure. And he said, okay, well, everything's going to be fine. And my appointment was like 9 o'clock the next morning. And I was like, okay. And my 2 daughters were with me. And we went out to the hospital, and then when they came in he came in to meet me first and met my daughters and talked to us. And then when the whole surgery crew came to get me, to take me back to get me ready for his part, my daughters went down to the cafeteria, and while they were getting me ready to go to surgery, I guess he went down to the cafeteria to get something or whatever. But anyway, he saw my 2 daughters over at the table having coffee, and he went over and sat down with them and told them that your mom's going to be fine. She's in good hands. And he told them what was going on now, and, not to worry. Their doctor was in the cafeteria. He was I thought that was very comforting. And then after surgery, he came into my room, and I remember this. He came into my room, checked everything after the surgery to make sure I was feeling okay and that there wasn't any bleeding or any complications in that period of time. And I went home by 1 o'clock in the afternoon. So from surgery at 9, a big surgery at 9, to dismissed at 1, I think that's pretty good. And I had no complications whatsoever at all. The person is very, very important to him. He takes care of your physical condition, your mental condition, and your spiritual condition. So he cares about the entire patient and the family too. It's all very important to him. I think he realizes the different aspects of a person's recovery that really help it. So I just cannot say enough about Dr. Creech. I tell everybody when they mention their knee is sore or anything, oh, you've got to go see Dr. Creech. So I have spread the word, hopefully.